Hello guys, good morning everyone. So today we're going to take up some doubts which students had asked me over a few days in the past. So let's take up those doubts. So one was about varenicline. Okay, so varenicline drug, it is used in dry eye. Okay, varenicline drug is used in the management of dry eye. And what is the mechanism of action? Okay, it primarily stimulates your nicotinic acetylcholine receptors. Okay, so when it stimulates the acetylcholine receptors which are present in the trigeminal nerve. See, trigeminal nerve endings are there in your nose also. So this varenicline for dry eye is administered like an intranasal spray. Okay, so it's not as an eye drop, it's as an intranasal spray. So what it does is it stimulates these trigeminal nerve endings. Yeah. So when it stimulates these, it also stimulates the lacrimal gland, innervation. So when this lacrimal gland innervation, that is the parasympathetic system, is stimulated, it not only stimulates the lacrimal gland, the entire unit, the meibomian gland, the conjunctival goblet cells, all of them receive parasympathetic input. Okay, so all these are going to be stimulated and all of them will secrete their respective components. So your lacrimal gland is going to secrete the aqueous component, your meibomian gland, the lipid component, then the conjunctival goblet cells are going to secrete the mucin component. Okay, so it will naturally increase the tear secretion. All right, so that is varenicline. So BU, you asked me that doubt another day, so I said I will clear that. So that is the mechanism of action. So yes, it is used in the management of dry eye and it is administered intranasally. Okay, now there was another question which another student wanted me to explain. Said so the question was, a pregnant woman presents with fever, retroorbital pain, headache and pulsatile proptosis of the right eye and tinnitus. BP and fundus were normal. Which of the following structures are involved? Okay. Now, when it is a pulsatile proptosis, so you know pulsatile proptosis, when do you get? You get it in keratico-cavernous fistula or arteriovenous malformation. Okay, so you get it in CCF or congenital AVF malformation. Okay, so there is a retroorbital pain, this headache, pulsatile proptosis and that tinnitus. And what else? She's also got fever. Okay, now this is not fever, all right, proptosis, yes, tinnitus, yes, but that doesn't make it orbital cellulitis. This is a little complicated question. Okay, so whoever framed this question, I'm not sure. But anyway, because a student asked me this question, so I'm reading it for you. So which of the following structures are involved? And option A, abducens nerve. Option B, oculomotor nerve. Option C, internal carotid artery. Option D, cavernous sinus. Okay. See, there is nothing to tell us that abducens nerve is involved or oculomotor nerve is involved, because there is no sign of diplopia or drooping. Yeah, so there's no mention of diplopia in the question. There is no mention of drooping in the question. There is no mention of ocular motility, which is subnormal. That is also not mentioned. So I can't comment on the the cranial nerve involvement. Yeah, so option A, option B ruled out. Abducens nerve, oculomotor nerve ruled out. Internal carotid artery. See, internal carotid artery, yes, can be involved, but again, it could be an external carotid artery, that's CCF. Okay, external carotid artery and cavernous sinus could also have a fistula. So we don't really know if it is internal carotid artery. Okay, because there's nothing to tell us that the internal carotid artery is involved. Okay, maybe if the cavernous sinus is involved, yes, the internal carotid artery in the cavernous sinus. Okay, now assuming this is a CCF or we are entertaining both the differential diagnosis. Because of that, pulsatile proptosis, congenital AVM, arteriovenous malformation, and caroticocavernous fistula. So that means there is involvement of the cavernous sinus and a carotid artery, a major carotid artery. It could be an internal carotid or the external carotid. So probably option C and D. Yes, only option C and D. Now that fever, just because there was a fever, I cannot entertain orbital cellulitis because there's nothing else. No mention of the vision, no mention, and they've also said fundus is normal. It's just a headache, retroorbital pain. Okay, so I have no other clue for me to go and choose abducens now because it's a combination of options. And in fact, in the options there is A, B, C, B, C, D, A, C, D and A, B, C, D. There's no way I can entertain A and B. Okay. So this was a student's doubt who had asked. So I said I will explain this to you all because I think you all must have gone through that MCQ. So abducens nerve ka involvement ka, there's nothing in the question. And oculomotor nerve involvement, again there's nothing in the question. No information in the question. The only relevant thing is pulsatile proptosis. Yes, pulsatile proptosis and tinnitus. Yes, in CCF you can have tinnitus. Yes, because there's an abnormal arterial pulsation which is being transmitted into the cavernous sinus and into the orbit. So, you know, this area, no? So you can get a tinnitus. So that is okay. Fever, retroorbital pain. When you have a CCF, you can have a retroorbital pain. Headache is kind of very non-specific here. Okay, so for abducens nerve, there's no mention of deviated eye, no mention of diplopia. For third nerve involvement, there is again no mention of a deviated eye, nothing about diplopia, nothing about droopiness of eyelid, nothing about the pupil, and again nothing about the extraocular motility. So I cannot entertain a cranial nerve palsy in this question. Okay, get it? And why am I entertaining internal carotid artery and cavernous sinus? Because the question asks which of the following structures are involved. Because in my mind, my differential diagnosis is only for the pulsatile proptosis. You remember I put up one let's do ophthalm MCQ series. I put up that video. I'll share the link of the video at the end of this session. I will share it in the comment section. Watch that. You'll know how a pulsatile proptosis looks like. So caroticocavernous fistula. Okay, so this pregnant lady is just like a distractive thing in the question. Okay, so there's nothing to do with the pregnancy. Okay, so because I'm entertaining these two differential diagnoses, that is caroticocavernous fistula and congenital AVM, that is the only reason why I'm choosing internal carotid artery and cavernous sinus as the structures that are involved in this patient in question. Okay, so it could be even external carotid artery, because sometimes you do have external carotid artery and in the fistula formation. Okay, now there was another one which students, you know, they asked me. One second, let me just get that okay, so today we are just doing the students doubt clearing session. One second, guys. Where was that third question I wanted to discuss? Just give me a moment, huh? Okay, if you have any other doubts in the meantime, can you please put it in the comment section so, you know, I can take a look and we can discuss that. All right, this image Okay, so this was the image that I wanted to discuss. So this image, can you see this image? See, this is a very dry looking keratitis, and this is not your routine fungal keratitis. Okay, so this kind where you see these multiple spots there, and it's like, like a wreath. Have you seen a wreath? When the prime minister, the president, they go and visit Rajghat and all these places to go, and or somebody is dead, they go and keep those wreaths, no? Or during Christmas you hang a wreath outside home. I mean, it's a very European thing, we don't do it in India. It's outside on everybody's doors, that wreath. Okay, so that wreath like appearance. Okay, so this wreath, it's very dry and multiple dots, that is a nocardial keratitis. It is not a typical aspergillus or a candida keratitis. Do you get that? So this wreath like appearance, yes. So you actually wanted to me to discuss this. So you can see a small hypopyon down there. See, the hypopyon itself doesn't tell you anything whether it is bacterial or fungal. It's very dry looking, just like fungal, typical of a fungal, very dry and leathery. But this kind of like a ring, no, that ring, we are not talking about immune ring here. This is the actual keratitis itself. Okay, so this is a wreath like appearance which you get typically in nocardial keratitis. Okay, nocardial fungal corneal ulcer. Is that clear? So this is one image that you guys had asked me, and another image was, one second, I'll just describe a typical fungal keratitis. So please remember, wreath appearance you get in nocardial keratitis. Okay. Where is it? Other image. The other image is this one. See, this one is a typical aspergillus keratitis, fungal keratitis. Okay, so see, here is your main ulcer, and these are your feathery margins, okay, which is a hallmark of fungal keratitis. Okay, so this is a typical aspergillus filamentous fungi keratitis. Yes, here also you have a hypopyon. So this, can you see the feathery margins, bache, all of you? Give me a thumbs up if you can appreciate the feathery margins. So this is a typical fungal keratitis. Okay, so that is your aspergillus fumigatus keratitis. And the other image that I showed you, that was a nocardial keratitis. Okay, so this is a nocardial keratitis because you have a round one, although this is also dry looking. Yes, and you have a typical, this multiple pinpoint ones. So that is a nocardial keratitis. Is that clear? So I hope this session was useful to you, and guys, make a plan, start studying. Your NEET PG is, see, some of you might say it's, ma'am, it's too far away, but good that it's far away, that you can plan, make a good plan and start studying, and make a plan so that you can finish off by INI-CT, May INI-CT, finish off one reading. Okay, so that the next reading or your revision, you can do it by NEET PG 2026. Okay, so that way you will not have too much pressure in your head. And some of you just want to do your exam and be done away with. I do understand that also, but take it as like, you have enough time for preparation. So aim at finishing your syllabus by May. Yeah, for May INI-CT, and then keep the rest of the time for revision. Okay, so plan it accordingly. Think that your NEET PG is happening in May and prepare like that, and then then shift. Okay, it's happening in at the end of August, so then you'll have ample time for revision. All right, so guys, so today evening at 6 p.m. we've got squint quiz, and tomorrow at 11 we will discuss the squint quiz questions. All right, so I think the Republic Day sale also is ending, so make use of that on the iMentor app, the discounts. And if you would like to join the test and discussion, and you can click on the link that is given below, you will be given free access so that you can take look at the first few tests and then decide if you want to join us through the series. All right. So bye guys. Have a good day, all of you.